49ers Nation, I'm extremely sorry about this. Fred Warner had a very ugly injury. Definitely not showing the video for that. It will be a season ending injury. What happened is he had an ankle dislocation. We saw this foot here evert outwards and stay everted outwards in a dislocated position, disrupting the talar dome right there with the tibia and the fibula. We get really concerned in these injuries. Chris Godwin had one of them as well, and that's because you can see what happens there. A lot of arthritis can form post traumatically. There's usually a high ankle ligament injury as well. So deltoid ligaments can get injured on that inside, but we also get concerned about this interosseous membrane and this anterior tibiofibular ligament, as well as a fibula fracture is usually accompanying it. Sometimes we get fractures associated with this. There can be a unilateral fracture, a bimalleolar fracture, or a trimalleolar fracture. The trimalleolar fracture would be the worst case situation. The malleolus is one side of the fibula, one side of the tibia, and then the back of the tibia. So those are the three malleoli that happen in these fractures. They also have to usually take him to a hospital setting. They want to palpate for pulses. Most importantly, that dorsal pedis pulse there, you can guess if the entire joint is dislocated. It can disrupt vascular blood supply. If you disrupt the blood supply, then you risk avascular necrosis or just blood loss, tissue death, all of that further down from the dislocation. So they have to reduce the ankle. They try and do that on peel, but still they palpate the pulses. Even if they get pulses, they still usually do a CT angiogram, which is basically a study that floods dye throughout all the blood vessels and make sure that there's no break in there. Overall, though, this will be a season-ending injury for Fred Warner.